We can move on to the next one, the final presentation, which is about the integration of components of PIM into the protection case management guidance developed by UNHCR and IRC. So if I can hand over to Huda Charkoul and Emily Krem, if that's fine. Thank you.
Hi, Babette, Jude. This is Huda Charkoul from UNHCR. Just to correct the family name. So before handing over and giving the floor to Emily, who will present the guidance in details, I wanted first to thank you for having us and offering us this opportunity to present the protection case management guidance. As you know, protection case management is key for UNHCR to achieve its mandated commitment to protect refugees, IDPs, and other persons of concern, and to enable their self-protection, self-reliance mechanism, and contribute to finding solution as well. So the protection case management guidance and forms were developed jointly through a collaboration process, and it's a partnership with IRC, and after consulting a reference group, and I'm sure Emily will provide you with more details on this, on the key actors who contributed to this guidance and the different field experience that the guidance is based on. So one of the main objectives of the guidance is to promote rights-based approach during the different case management phases, as well as promoting accountability across organization and clusters to adhere to the minimum standards required for quality, principled, consistent, and coordinated service provision, and to avoid the application of efforts or gaps in the protection response. Therefore, a stronger standardized case management system will certainly contribute to establishing a stronger protection information management system, able to provide quality data and information on people in displacement situation in a safe, reliable, and meaningful way. So I will give the floor to Emily, who will present the guidance, its annexes, and the next steps, and will encourage all the participants to contact us bilaterally if they want to test the guidance in the field. And Emily for sure will give you more information about how to do that. Thank you. Emily, over to you.
Thanks, Huda. Hi, I'm Emily. I'm a Protection Rule of Law Technical Advisor with IRC, and this presentation will briefly explain why we created the guidelines, what excites us about them, and how it fits into the PIM framework. So in the communities where we were working, there was always a sense that something was missing for the clients that we were working with, that they did not fit into the classic humanitarian GBV or child protection case management programming. They were clients that experienced trauma, but they were not, you would not consider them having experienced gender-based violence, or they were not children. So in response to this, we had a number of country programs who began piloting approaches to protection case management without necessarily a standardized interagency guidance. And two of those examples were Lebanon and Uganda. Based on this learning, IRC developed in 2019 a first draft of this guidance. However, this guidance we felt was really defined about what it was not. It was not gender-based violence case management. It was not child protection case management, but we were having trouble articulating what it actually was and why it was different from these two systems. And then in 2020, IRC and UNHCR collaborated to develop the first interagency protection case management guidance. And these guidelines emphasize the importance that we shift from a rights-based approach to be able to support clients who are at risk. Next. So some of the components that are new and different about this guidance, we'll be reviewing 3 out of the 4. We don't really have time to go into our human rights theory and our inclusion approach, but we'll be going over the other 3. Next. So as Huda mentioned, this was developed in coordination with a couple of the key PIM principles of collaboration and standardization. Well, the guidance was written by a consultant, Colette Hogg, who drove the whole process. She developed closely with a reference group that include members at DRC, UNHCR, IRC, both headquarters and representatives from country programs, and consulted very closely with HI, Humanity Inclusion, and IMC. What was missing, however, is consultations and membership of local organizations on the reference group, but we are hoping to rectify this omission during the next phases of the rollout. And then this guidance, again, oh, sorry, almost done. This guidance also aims to bring together the wider protection community and provides a common language and common standardized definitions, tools, and approaches across agencies. We are not quite there yet in terms of mandating everybody use the exact same tools, as these tools have yet to be piloted and tested. However, we think it is a first step towards moving towards that standardized approach. Next slide. Another component of the guidance that we think really fits into the PIM framework is the emphasis on analysis. The guidance really is grounded in the context of where they are. It emphasizes the importance of understanding the context, who the key stakeholders are, and using a protection risk analysis to frame the approach. Most importantly, to understand the types of violations that might be present, their root causes, causal agents, and who is most at risk of experiencing them and why. And this context analysis directly leads into the prioritization of cases and targeting criteria. It helps us think through who should be targeted for this program, who is the most at risk. So for example, our teams in West Africa might have a very different targeting criteria than those in the Middle East. And that is something that is emphasized throughout this guidance. Next. So moving on to how we are defining protection case management. So this guidance defines protection case management as a structured and sustained method for providing responsive and remedial support to a person at heightened risk of rights violations in order to manage and ultimately claim their rights, leading to safety, dignity, and ensuring resilience. The caseworker informs the clients of all available options and supports them in identifying them, reaching their personal goals by leveraging their strengths and working with service providers. This definition is in line with the PIM matrix, which categorizes case management as one of the key interventions. Next. So who are we supporting with protection case management? This case management moves away from supporting predefined vulnerability categories that can be used such as generically as persons with disability or older persons. Instead, it looks to examine a balance between the risk factors and the protective factors. So on one side of the fulcrum, we have our risk factors, which are defined as the factors which are a part of and determined by the environment which our clients live in, whether that's physical, social, or economic, and how that environment interacts with certain characteristics of the individual that could possibly increase their likelihood of experiencing rights violations. And on the other side of the balance, or other side of the fulcrum, we have protective factors. And these refer to all the strengths, attributes, capacities, resources available within a society, within a community, or that are inherent to the individual that allows them to manage and reduce risks and strengthen resilience. We use this definition because it acknowledges a person's characteristics and circumstances, which could be their age, gender, disability, or other diversity considerations, which can result in risk factors when they interact with threats and barriers in the wider environment. However, it does not assume that a person is inherently vulnerable because they are older or if they have a disability, but if the environment itself creates threats to their safety or barriers to accessing their services. So it really emphasizes looking at a situation holistically. It also emphasizes people as active agents in dealing with their own difficult situations and the critical role in protective factors, their own strengths, their resources, and their capacities in reducing the risk factors. It also implies that a certain combination of risk factors can intersect, creating an intersectional approach to increase a person's risk and create a unique experience of oppression. In conclusion, it recognizes that whether a person is at heightened risk, we need to understand the wider social environment as well as their own protective factors. Next. So the guidance also has a section on data protection, which again fits into the PIM network. And the data protection section is divided into 3 different components. One is on documenting client data. So in this guidance, we've piloted and standardized forms for use in various settings. And these forms have gone through a review process, but are very much a starting point for developing and harmonizing case management forms. As the PIM matrix mentions, this data is essential to inform decisions around each case and well as programming as a whole. And there is a definite gap in the protection case management component because we don't have a standardized information management system like GBV does, the GBV-IMS or the CP-IMS. There's currently no standardized database yet, and we are currently using a mix of paper forms, Excel, ComCare, sometimes Primero. We hope in the next steps to develop something a little bit more standardized, but we are not there at this exact moment. The second component is the importance of protecting client data. So having minimum standards of data protection, we have an annex on that, and it provides a data protection checklist, staff data protection agreement, and a sample data protection protocol, including the handling of handling data in emergency situations, such as evacuations. And lastly, information sharing. So ensuring that the information we do collect can be used to support the clients either through referrals or to advocate with different organizations, as well as where relevant and where safe to aggregate information to sort of inform larger programmatic decisions. So we can use these shared definitions ideally across interagencies to really sort of understand the context a little bit more. And that, I really rushed through that presentation. We are done. So the next slide is our contact information. So please do get in touch if you want to learn more about the guidance, if you'd like to have access to the guidance. We are in the process of designing it and making it a little bit more snappy, and then we'll be able to send that out. We're hoping to present the package in a little bit more detail at the GPC, and we are hoping to do some initial pilot rollouts with the IRC and DRC programs. So yes, any questions?
Hi, Huda, Emily, this is Jude. Thank you very much. Does anybody have any questions that they would like to put forward? If not, I have a question. Okay, we've got a question from Steph that says, how are you choosing where to pilot the system?
That is a great question. So it depends on if we receive a lot of dedicated funding for the pilot or not. If we don't, then it will be currently where IRC or UNHCR has the ability to be able to pilot this, basically. But I know there are some also DRC programs that are interested in piloting this as well. So if you are interested in accessing the toolkit and participating in a pilot, please get in touch with Huda or myself.
Thank you. I just wanted to ask, I think at the beginning you mentioned something about this being grounded in, I think you said inclusion and human rights theory. Can you explain a bit more about what you mean by that or how you've done that?
Of course. So for the human rights theory, we really try to emphasize throughout the guidance that our clients are rights holders is one thing, so to shift away from a sense of emphasizing vulnerability and more emphasizing our clients as being having a right to these services, having a right to safety, etc. Also, the prioritization criteria and how we're targeting is based on those who are experiencing rights violations, and it is categorized through that. So we do bring in the legal framework to understand who we should be targeting based on that risk threshold. So that's more of the human rights-based theory. The inclusion theory is something that I find quite powerful that is quite clearly brought out in the CRPD, so the Convention for Disabilities, as well as the new IAC guidelines for how to integrate persons with disability into humanitarian action, is their emphasis on barriers and understanding that a person's vulnerability isn't based inherently on having a disability or not having a disability, but really it's how they interact with the environment itself. And for me, I found it to be a really important framework to shift away from categories of vulnerability and more to having a more sort of nuanced understanding of how people sort of operate in the world we live in.
Yeah, very interesting. Thank you.